Okay, hi everyone. Thank you for joining us. I am Tanner Gillette. I am the Graduate Enrollment Coordinator for the University at Buffalo School of Nursing. Thanks so much for joining us to talk about our CRNA program. So we have kind of a jam-packed session for you guys where we're going to be talking about really all things CRNA. We have a lot of people on this call, so please, if you have questions, use the chat function. Please don't try to speak over anyone and try to please keep yourself on mute the whole time, since we will be recording this. We're gonna record it, that way you guys can have it at your leisure. I'm gonna email it out whenever it's done rendering, and we're also gonna add this to our website as well, so you'll be able to refer back to it. There will be time at the end. I know that I don't remember what end time I gave this, but we will stay on as long as there are questions. Again, just try to use the chat function and we will get going. So with that, I am going to turn this over to Dr. Cheryl Spulecki, and she is going to give you an overview of our program. Dr. Spulecki, take it away.
Thank you. Hi, everyone. Welcome. It's great to see so many faces. I appreciate you taking the time out of your day to listen to what we have to say and your interest in advanced practice nursing and nurse anesthesia. I am the current director of the nurse anesthesia program here at the University at Buffalo. I've been a program director for a few years now. I've been part of the program since 2006 as an adjunct faculty and full-time since 2013. I currently have my doctorate in nurse anesthesia practice and am licensed as an acute care nurse practitioner. And I work closely with my colleagues, Dr. Carla Moscato and Dr. Eric Ledwin, who will both be speaking in a few minutes. The nurse anesthesia program is a 3-year program, like all of the advanced practice nursing programs here at the University of Buffalo. We have the luxury of being a part of a three set focus of both research and scholarship, anesthesia, and the core courses that you will be taking or interested in taking with all of the other nurse practitioner graduate students. The program is considered full-time. There's 124 credits over a 3-year period, including 3 summer sessions. We do take a break between the sessions and between the semesters, and we certainly prepare you, of course, throughout the program to take the national certifying exam to be board certified as a nurse anesthetist. We currently are enrolling all our students in a national review program online called Apex Anesthesia, which we start implementing the first semester that you are in on the program. All of our nurse anesthesia faculty take part in the anesthesia core courses and are all practicing clinicians. We all take time out of our week to practice in the operating room, making sure that we get a chance either to work with our students or to keep up with best evidence-based practice regarding anesthesia and nurse anesthesia specifically. We offer, as you will soon find out when Dr. Moscato speaks with you, 17 clinical sites throughout Western New York and Central New York. The purpose of the clinical sites is to help meet the objective of the program, which is a set amount of clinical hours and clinical experiences in all types of anesthesia. You'll also have the opportunity to work in a simulation lab with a simulation mannequin in our simulated operating room in the basement of Wendy Hall. So you will have plenty of experience with induction of anesthesia, preoperative assessment of patients, managing anesthesia crisis, as well as opportunity in the operating rooms of those 17 clinical sites, performing all types of anesthesia, general, sedation, regional anesthesia, which includes peripheral nerve blocks, epidurals, spinals, general anesthesia, which includes endotracheal tubes, LMAs, or mask management. And remembering that we are a part of a nurse anesthesia program where you have hands-on experience. You are not going to leave the program as an assistant or a helper or as an anesthesia tech, but you are an advanced practice nurse, which will carry your doctorate of nursing practice as a nurse anesthetist. Our program also incorporates the integration of the advanced practice nursing faculty, which are a part of the adult, family, and psych programs as part of your professors that are leading some of the core courses. And of course, the PhD prepared nursing researchers that are part of our research courses and preparing you for your doctorate of nursing practice scholarship project. So you'll get to meet a lot of people incorporated in all of the graduate school programs. You'll be familiar with other professions and be in core courses with students that are interested in adult, family, psych, as well as anesthesia. But our core cohort is specific in that we are full-time for 3 years, and you travel through the program with a set group of students that are in the program for the full 3 years. We do not have a part-time program. You can't decide to take one class one semester and maybe 2 classes another. You follow a strict curriculum that takes you through the 3 years in a time period that's pretty intense, but with lots of support from all of us at the School of Nursing. That also includes graduate services, which is a huge help, and financial aid, which is well aware of the expense of the program and getting you situated from semester to semester with any concerns that you have in regards to your schedule, in regards to the current coursework or any changes within the curriculum. In addition, Dr. Moscato assists with the clinical coordinating. So at every clinical site, you have someone who's assigned to sort of man the site and make sure that they know that you are coming and make sure that you meet the objectives of the site, that you're not just walking into a strange facility at a period of time without knowing exactly what your objective is at that site. So we keep a pretty close eye on you through the 3 years that you're here with us. We also all carry office hours. Of course, you can speak with all of us throughout the semesters via Zoom, which is now our normal way of communicating with many of our students, but now transitioning back onto campus in the summer here and in the fall full time, as well as text messaging, emailing, and giving us a call whenever our students have any concerns or issues. So our program is one of the older programs in the country. We are now in our, I believe, 11th class that will be completing their doctorate of nursing practice. So we've been around for a while where we have been in the doctorate curriculum. It's not new to us. It has certainly gone through stages of development since we became a doctorate of nursing practice at the University of Buffalo. But it's pretty well established to get you through successfully meeting the criteria that's necessary for your scholarly project. We have many advanced practice nurses that are in other specialties assigned to the Doctor of Nursing practice along with the nurse anesthesia faculty to assist you with whatever project you so desire to complete as part of your doctoral project. But by no means are you going to be alone in that decision making. So we're all really excited to be a part of the program. We're very committed to our students and very committed to the success of our students. We always set up a plan of success. We always continue to have communication with our students as you move on from being a newbie and needing some serious direction and supervision to giving you the autonomy that you need when it's time for the end of the program and graduation. So you can walk into any operating room or any facility and perform anesthesia as a nurse anesthetist. We certainly offer a clinical experience that is above and beyond the minimum standard. So plenty of clinical hours and opportunities to meet all of the requirements necessary within the program. So that's just a brief overview. I'm sure you're going to have lots of questions later, and we'll certainly be around to answer them. And again, thank you for coming.
All right, thank you, Dr. Spilecki. That was an excellent overview. Now I'm going to turn it over to Dr. Ledwin, who's going to go into a little bit more of the details regarding the didactic coursework that you guys would go through in your program. Dr. Ledwin, I'll turn it over to you.
All right, hello everybody. So part of my job here is to go over just the curriculum for the for your 3 years of being in school. This is a really nice picture that kind of shows the generations of CRNAs that have all graduated from the University of Buffalo. There's just a nice picture that was taken. Dr. Opes in the middle was the program director until he retired. This was his party, but it was a good time to get everybody together. So you can see a very diverse group, crowd of people, have all come through the program. So, first year is going to be probably the most challenging year for everybody. It's just getting used to being a student again. We require that people work in the ICU beforehand. So you've gotten used to a paycheck, you've gotten used to, paying your bills, you've gotten used to going through everything. So coming back to school full time can sometimes be difficult. The Principles of Anesthesia 1 course is basically the chemistry and physics of anesthesia. So we dive really into the why things work, like why a ventilator works, why your IV tubing flows work, like why it's better to have a 14 gauge IV for a trauma versus a 22. They're things that you kind of instinctually know, but you may not know the exact physics and laws behind it. And then we get into also how the anesthesia machine works and the kind of fail-safe devices that we have within it. And then we also have advanced pathophysiology, where we go over not only adult, but pediatric pathophysiology. You take advanced health assessment, which again includes the assessment of the adult population and the pediatric population. As CRNAs, we have to be able to take care of, everybody from the very, very young to the very, very old. When you get out into your personal career, you can always choose to do more adults or do more pediatrics, but we have to be trained on everything. So you have to go through all this coursework. Then scientific writing, again, learning how to write. You're going to be required to do the doctoral project, which does require a lot of writing. So, you need to learn how to write, remember how to use the APA again. They just came out with recent changes. So you need to know what those changes are in order to meet our standards. And you'll notice that most of the coursework involves a little bit of anesthesia classes and a little bit of what are called your core DMP classes. So then in the fall, you transition to general pharmacology, you take more pathophysiology, you get into program evaluation, professional aspects of the nurse anesthesia practice, which gets into some of the political things about anesthesia, and then also the challenges that you might have to face, not only on a practice level, but also a state or national level. And then evaluating research. Again, this is a doctoral program, so we have to do the research portion of it. In the spring is when we'll transition to kind of getting ready for clinical. So Principles of Anesthesia 2 goes over all the important parts of clinical. What size ET tubes to use, different masks for the pediatric populations versus the adult population. Basically all the basics of how you operate in the OR, how you position patients, so they don't develop nerve injuries. And then again, we get into clinical pharmacology for anesthetics and adjunctive drugs. So this is another very kind of intense course, learning about every drug that we give in anesthesia, how the inhaled agents work, how the IV drugs work, how your muscle relaxants work, and your dosings for those in clinical application. For those of you who do get into the program and go through it, you'll find that there's a lot more gray in anesthesia than you would think as far as clinical dosing. Sometimes you might just give 100 milligrams of a drug, and other times you might need to give 250. You have to know the important details in that. And again, going back to the core courses for your DMP, applied informatics, learning how to evaluate kind of healthcare outcomes. And then you'll find that a lot of informatics are used in the evaluation of your anesthesia practice. So things like your post-operative nausea, vomiting rates. If you do a lot of epidurals, what's your post-dural puncture headache rate? All those things are kind of implemented into the informatics, how to take large amounts of data and get meaning out of it. So then once you get through your first year, you kind of learn how to be a student again. You've gone through it, and you start clinical residency. Dr. Moscato will get into the specifics about each site and where you're going to go, but this is where you get the hands-on experience. This is where you learn how to do anesthesia. You can read a book all day, you can memorize all the steps of to put an epidural or a spinal, but you have to put your hands on the patient, you have to do it. So we have a lot of clinical hours. It's a big transition, even from nursing school, when you might have had just 1 or 2 patients, and you may have gone just 2 days a week. We're in the OR 4 days a week, typically, unless you're working on your DMP project, in which case we go down to 3 days a week. And while you will still deal with 1 patient at a time, you may have 4 or 5 surgeries that you do in that particular day. And then we have healthcare policies. 598 is the introduction to anesthesia clinical practice. So we actually just finished up that for our first year clinical students today. So it's kind of an intense month between urology, basically, where you learn all the hands-on skills. You get the mannequins out. We practice putting in arterial lines. We practice putting central lines in. We practice intubations. We practice epidurals, spinals, and then we also teach you guys kind of like the flow of the OR, like the induction process. Because there's certain steps you need to do in order to make sure that you provide safe, effective care. And it's safer to do it in simulation with us, just to kind of get all the kinks out. And then when you go into clinical practice, you can use those skills. In the fall, you start getting more into the particulars of the anesthesia practice. So you've learned the basics, you've learned the physics. Now you start learning about how each disease process affects our anesthesia delivery. And you also start to learn more about how nerve blocks work and stuff like that. You may learn the physical hand skills, but now you're starting to get more into the nitty-gritty details of it. Current topics in anesthesia is another great course where we kind of just talk about what's going on in anesthesia. Is there something, new drugs on the horizon? Is there an increase in like turnover rates, burnout, stuff like that? We kind of dive into the other non-technical issues of anesthesia. And then the state of the nursing science is part of your core. And then the spring, we just kind of continue on. So the principles courses go all the way through principles 5. Principles 4 is where we go over like obstetrics, and we get into pediatrics a lot. And again, that's also when we start working on our DMP projects. So in the fall, you will identify a topic, and then in spring is when we start doing the DMP coursework. So this is where you might see a reduction in your clinical hours, and then to give you a little bit more time with the DMP projects. So here's a few pictures from us in simulation. So we have central lines. One of these is from our pig tracheal labs where we learn how to do emergency cricothyrotomies. The fiber optic machine, the glide scope. And it's just a good view of like how we do it and the kind of camaraderie that you'll get being in this intense program with the 20 to 24 students that we may have. So here's the kind of part where, the doctoral part of your project. This was a presentation, so a dissertation of their project was Precedex protocol for laparoscopic bariatric surgery. The important part about the DMP project is that it helps build the practice and helps build clinical relevance. And it also helps adapt protocols. Like protocols might be implemented across the country that are very successful, but we haven't seen them here. But because you're a student, you're doing lots of research, you might notice that, hey, this protocol works very well, in California. Can we implement it here, in New York or at your current clinical sites? So it's again, it's adapting your research, your knowledge, and then being able to evaluate these protocols and then hopefully provide better care for your patients. So year 3 is obviously the exciting year because it's the year you're going to graduate. So you go through Principles 5, and then we complete our DNP coursework. And then we also do what's called Anesthesia Crisis Resource Management. It's where we simulate crises in the OR that you may not see every day in clinical. Some of the anesthesia complication rates are 1 in 250,000. So you may not ever see a patient have malignant hyperthermia or a pseudocholinesterase deficiency. But we are able to safely simulate that in the lab, so that way you can see these experiences before, and then hopefully develop some muscle memory recognition and how to deal with it. And then the fall is basically where we finish up your DNP project. You'll collect your data, you'll do your dissemination. And then you complete your organizational leadership concepts. Again, the DNP curriculum in general. And then in the spring is your last semester. We do another anesthesia crisis resource management class. And again, it's to build on those skills and those non-technical skills too. Kind of like the critical thinking that we do in nursing every day. And then you take teaching and nursing as well. As part of being doctorally prepared is that you can go forth once you get some clinical experience and come join, the faculty here, and then provide choruses, lectures, especially if you have an area of clinical expertise. So a lot of the students, sometimes they feel like during the program, studying, notice how they conveniently put dying at the end. It can be very intense. There's a lot of support that's offered through the school, and there's also a lot of support offered amongst your peers. So we have our more senior students mentoring our younger students when they come in. So that way they can ask the questions that they may not feel comfortable asking us as faculty. Or if they feel like, you didn't do as well on a quiz, because this is very hard material. Sometimes you might get an 80%, you might get a 75 when you're used to getting all A's. You feel like you're studying, but not getting the material, but it will get better. And we're here to help you guys get through the process. It has become more convenient, like Dr. Spulecki said, with Zoom. You don't have to make it into our office hours if we have like an hour or two block. We become more flexible with Zoom and being available to you guys. So, but by the end, everybody will be happy, smiling. This was my graduating class from 2015. You can see Dr. Moscato in there as well. So there is light at the end of the tunnel, and it is a great program. And being a CRNA is one of the best careers that you could ever have in nursing. And we'll save the questions for the end.
Great, thank you, Dr. Ledwin. Yes, I forgot to mention, both Dr. Ledwin and Dr. Moscato are alumni of our program from the class of 2015, if I'm correct. So now I'm going to turn it over to Dr. Moscato, who is going to talk to you all about the clinical side of things. Dr. Moscato, take it away.
Well, hello. So, clinical is one of the most exciting and sometimes most stressful times while you're in the program. You actually get to use the skills that you learned, but sometimes it's pointed out that you don't know much, right? But there's a lot out there to know, and there will always be someone smarter than you, so that's okay. We'll get through it. But I'll just go through and just give you a brief overview of the clinical sites and the experiences that we have throughout the program. So here's good old New York, and all of these little dots is the best that I could do to represent all of the places that we go to. So the majority of our sites are located around here in Western New York, around the Buffalo area. We have, some Niagara Falls sites. We do have a couple that are, Batavia, Medina, so in between here in Rochester. We do have a site in Syracuse, and then this little guy way over here is Cooperstown, which I will be going to because my son has a baseball tournament. So I'm super pumped to go visit Cooperstown. So maybe I'll see some of my students there. So it is 6 semesters of clinical instruction, 9 semesters total, like Dr. Ledwin went through, and it is a combination of, we do try to make your time work out so that it is clinical and didactic all combined into one. It's definitely, when they say it's full-time, they're not kidding. The first year, I do know that many of the students will continue part-time employment or per diem employment. Then after that, it gets very difficult. I do know of some heroes that have made it all the way through, giving up their weekends, for example, to continue their seniority or their status at a place of employment. But it's hard. You're in clinical about 36 to 40 hours a week on top of taking classes. So you're going to lectures 3 to 6 hours a week, also doing online asynchronous material. So if you're like me and you have small children when you're in this program, time and patience become very thin. So I just want to make sure that you guys know, to become financially and emotionally set before you take this on, and let your family know too, that it's quite the commitment. But it's, as Dr. Ledwin said, it's worth it. It's 3 years seems like a long time when you're looking at the front end of it, but when you look back, and you can ask every class as they graduate, they all say the same thing, that it really flew by, and they're so happy that they completed it. But so 4 days a week, usually Tuesday through Friday. We do have some sites that have some crazy hours, right? Because surgeries and traumas and anesthesia happen. Also, not just 9 to 5, right? We go through, I won't really go into these classes because Dr. Ledwin already did, but the intro to clinical, we give you all the simulation and hands-on stuff front loaded so that then you can use those skills as you progress from one site to another. And then 598 again with the hands-on. This is a little depiction of our little spinal dummy over here to the side. 4 to 8 week rotations at each site. So your first site that you're sent to as a little newbie, we do send you there for the entire summer. So that's 12 weeks long. And that really gives you time to get your feet wet and start to feel comfortable, and really start to learn the routines and taking care of patients in the OR. And the routine of anesthesia before we then, take you out of there and put you in a whole new environment. Because sometimes when you're starting over at a new place, I'm sure you guys have had new jobs, right? You went from being the person that everybody goes to, that knows everything, knows where everything is, to then go to a new place where you're down a few rungs. So it gives you a chance to really feel comfortable before we put you somewhere else. But then the fall and spring semesters are 16 weeks total, so we usually split those into 2 rotations. Certain sites, like our pediatric, our Oshai Children's Hospital, because we only have the one site, really. We do get peds at other sites, but that's our peds rotation. We have to get all 20 to 24 students through there, so we take turns and we go for 4 weeks at a time. And they're so busy there that you get plenty of cases in those 4 weeks. You are mentored and precepted by a CRNA, sometimes a MDA, which is an anesthesiologist, or both. You're never mentored by another student or a resident or anything like that. It's always someone who is licensed. Every day, the preceptor that you have will fill out a daily evaluation of how you did. And then at the end of your rotation, the clinical coordinator will compile all of those evals into a summative eval that then you will meet with the faculty at UB, go over how you did, what you did well, what you need to work on, and what we're focusing on for the next rotation. There are overnights and, as you saw with my little dots, out of town locations. So I'll go into each site kind of towards the end here. But kind of along the progression that we set up the curriculum, and you travel along in that very specific cohort and that order of classes, because we take you from being the excellent ICU nurse that you are to throwing you into a completely new environment. There's some familiar stuff, but we guide you through into then you become an excellent nurse anesthetist by the end of it. We do have all sorts of types of anesthesia that we do. CRNAs can provide all of these types, from general anesthesia, meaning completely asleep with the tube, airway, something like that, regional and peripheral nerve blocks, so numbing just the extremity that you're working on, or doing a spinal or epidural anesthesia, numbing from the that area of the spine down. We do pre and intra and post-operative care, so we can assess the patients in pre-op, make sure that they're medically optimized to go into surgery, obviously then also care for them every second that they're in the operating room, and then assess how they're recovering in the recovery room. Yes, there's other staff that's involved, right? Pre-op nurses, post-op nurses, and OR nurses as well, but we all work together as a team and see that patient from beginning to end. And we do have the requirements for licensure is 2,000 hours of anesthesia time, and we have it built into our program that you get well over that. I've seen people graduate with almost 3,000 hours of experience. So of course, anesthesia, can be done for all sorts of parts of the body. So we have an open heart and vascular rotation, and we have multiple sites where you can get OB, labor and delivery, lots of ENT, head and neck. There's a few sites that specialize in trauma anesthesia, but sometimes you can't control when a trauma comes in, and you got to be prepared for that. So that can be done at almost every site. Neuro, oncology, we are blessed to have the Roswell Park Cancer Institute here in Western New York, and they do some amazing things there. Pediatrics, like I said, we have OSHI, formerly known as Women and Children's Hospital of Buffalo, but we do get pediatrics in other sites as well. And then outpatient, inpatient, rural, suburban, urban, we're all over. You saw the dots on the map, and what's great about New York State is we have all of those settings, and they're really not that far away. So just to go through our 17 sites just relatively quickly, just so you can get an idea of where you may be going. We have Gates Vascular Institute right here in Buffalo. There's I shouldn't say little, it's a few city blocks, medical corridor down in Buffalo that a lot of these hospitals are all within a block of each other. Gates Vascular Institute is our big cardiac rotation. They do vascular and neuro cases. And here's Roswell, I kind of mentioned before, specializing in oncology, cancer care, cancer treatments, and of course, cancer can be anywhere in the body, so they do surgeries on all of those areas, from brain to lung to spine to everywhere else, and as well as then doing plastics and reconstruction of any areas that were devastated by a tumor. ECMC, near and dear to my heart. That's where I started out my career as a nurse, and then also as a CRNA. This is also in Buffalo, a little bit further, about 5 minutes away or so from that medical corridor I spoke about. But this is our Western New York's Level 1 Trauma Center. So you can do an overnight call here. Really, it's 24 hours a day, 7 days a week. So Christmas Eve, weekends, doesn't matter. Traumas are happening, and we send students there for 16-hour call shifts. So you go in at 3 in the afternoon. There's a call room where you can keep your stuff, and if there's nothing going on, you can kind of hang out there until something does, so that you're instantly on call. 2 16-hour shifts, so from 3 p.m. until 7 a.m. And it's an excellent rotation. It really gets you prepared for everything. But they also have a burn unit there, so burn surgeries, lots of ortho, neuro. They do organ procurement as well as transplants, and then ECTs as well for major depression. Then we have a couple ambulatory centers. So the ambulatory surgery center on Klein Road is right in the suburbs. So again, where it's ambulatory in and out, it's in the suburbs, outpatient procedures. You do get some pediatrics at a location like this. We go from one extreme to the next, right? The other one was 24 hours a day. This one's, Monday through Friday, sometimes not even on Fridays. It's a nice place to work. The VA is actually right across the street from South Campus here in Buffalo, of course, caring for veterans, and it covers anything that the veterans would need, any procedure, any, major surgeries, right down to their colonoscopies and cataract surgeries. They are a very complex patient population. They all have multiple comorbidides, and they everywhere from guys in their 20s, guys and gals, I should say, in their 20s, to all the way up to octogenarians and higher. They do cardiac surgery there, thoracic, vascular, just general, and then, like I said, the GI and urology. Millard Fillmore Suburban Hospital, again, it's in the suburbs, nice easy parking. They do some OB there, women's health, general surgery, and plastics. Buffalo General Hospital is actually attached. You can see this blue building over here is Gates Vascular Institute, the first place I talked about. So we're back down in Buffalo, right in the medical corridor. They do some pretty involved cases, some pretty sick patients, spines, general anesthesia, ortho, GI, and urology. Sisters of Charity is on Main Street in Buffalo. They lots of OB there. Suburban, lots of OB, lots. Like many, like multiple women a day are giving birth at that place. It's crazy. And at that place, you can do an evening shift there, because women don't give birth just between 7 and 3, right? So you'll do an evening shift there so that you can get some of the traumas that come in, as well as OB. Sisters is affiliated with St. Joseph's campus, which is in Kenmore, not too far from Buffalo. More of a general surgery, and actually turning into kind of an ortho ambulatory center at this point. They were the COVID hospital during the pandemic, and now they're going through like a personality change. I'm not exactly sure what's going to end up there, but we will be involved in it. Then here's our Children's Hospital, which again is right down in that medical corridor. This is our pediatric specialty hospital. Any surgery that a pediatric patient would need, they go to this hospital for those surgeries. So head to toe type stuff, but all on pediatrics. Here's our other surgical center. It's in the South Towns in Orchard Park, down where the Bills play. Hey. Regional ortho, plastics, podiatry, again, in and out, outpatient only, ambulatory type surgeries. Niagara Falls Memorial, on America's side of the falls, not too far, probably maybe a half-hour drive from campus. They do OB there, general surgery, regional anesthesia. It's a really nice site, especially for first-year students. Then we have Medina Memorial Hospital in Medina. It's a community-based rural hospital, and it's one of our only CRNA only groups. The other ones that I spoke of previously have a team model, meaning there is an anesthesiologist, that's working with 2 to 3 CRNAs at a time and supervising the care, whereas Medina and Batavia are CRNA only, and we're working on adding another site as well. So that's a whole nother experience, not just in the patient population, but also your plan of attack and your team mentality. It just gives you a lot of independence, kind of working on your own in that kind of setting. So in Batavia is UMMC, as we call it, United Memorial Medical Center. Again, CRNA only. So not only getting the more rural population, but also just working only with CRNAs. Strong Memorial Hospital is in Rochester. Awesome sites. This list is not even all inclusive. They do all sorts of procedures there, liver transplants, general surgeries. There is a pediatric hospital in or as part of Strong Memorial, and a lot of complex patients, and just every student that goes there is just like, it's awesome. I love everything about it. So it's worth the drive. Upstate in Syracuse. This is another site that students will say it's worth the drive. They do a lot of OB, general surgery, and ortho there. And then good old Bassett, which is down in Cooperstown. It's a level 2 trauma center, so you do get some traumas there. Lots of OB, and it's also a heart rotation, open hearts, and those sorts of procedures there. And then we are always expanding and always working on other sites to add to the collection and to your experience. So right now we are super close to sending some students to Dansville, New York, which I think was like an hour and 20-minute drive from here. It's associated with the U of R medicine group. And then also St. Joseph's Hospital in Syracuse, New York. We're just in the infancy stages of adding that to our rotation, but they do, we're hoping to add them as part of our cardiac experience. So it's a lot. There's a lot of places, a lot of different experiences. For those sites that are out of town, we currently do not have housing in the Syracuse location. Well, for community general, St. Joe's, as we're adding it, there will be a place for the student to stay. And right now, Strong does not have housing. They did, and then the pandemic happened, and because they were the students were staying in, is it still called? It's not called the Ronald McDonald. It's like the Hope Lodge. It's housing for patients and their families, and the students were allowed to stay there. But since the pandemic happened and we're all isolating from each other, we weren't allowed to do that anymore. So I'm not exactly sure what's going to happen with housing there. But other than that, there is housing in Cooperstown. Like I said, we're working on the housing in St. Joe's. Did I leave any ones out that are super far away? The other ones, I mean, if you have to drive 45 minutes, you just got to get up earlier, I guess. And I think that's it.
Great. Thank you, Dr. Moscato. That was a great overview. With that, we are going to go into our student Q&A. I can assure you, I'm going to get to the admission requirements. I saw the questions that came in early. I know that most of them are about the admission requirements. I usually save that till the end. And also as a sidebar, I'm born and raised in Cooperstown, Carla. So if you need any tips, happy to send them your way. It's a beautiful little town, especially in the summer.
Yes, I'm excited.
So with that, I'm going to introduce our two students, the current students that we have joining us to give their experience. We're going to do a little roundtable with them, if you will, virtual roundtable, that is. So Rebecca Ives is currently going into her third year, or just started her third year, and Nicole Marchese, I'm sorry if I mispronounced that, just started her second year. So I am going to spotlight them. There's Nicole and Rebecca. There's Rebecca. Hi, Rebecca. Hi, both of you.
Hi.
Thanks so much for joining us so that you can kind of give your student perspective on things. So I guess to start, can you both just kind of introduce yourselves? I know I said what year you're going into. Hopefully I got that right. Could you let me know where you worked prior to starting the UB program and what hospital setting that is? And what made you interested in the CRNA profession in general? Just to kind of give your, what made you go for the program, then we'll go into some other questions after that. So I don't know, and either one of you can start. Take it away.
You can go ahead, Nicole.
All right, sounds good. So my name is Nicole. I am originally from Long Island, so I worked in the NYU Medical Center down there. And I worked first I was in a telemetry unit for about 2 years, and then I moved into the ICU as a combination cardiovascular surgery and trauma surgery unit. So I got to see a lot of really cool stuff. And then I actually left right in the middle of COVID when it was, pretty bad down on Long Island, and came and moved to Buffalo. So far, so good. And did I miss anything about, why I became a CRNA? So my dad is actually a surgeon, and he used to let me shadow him all the time. And I was never really interested in what he was doing. I kind of always was gravitating back behind the curtain. So, I decided to pursue it. I shadowed more and more. And once I was in the unit, I spoke to a lot of the anesthesiologists, and I just loved the culture of, everybody is so smart, but also laid back. I kind of felt like you're on when you need to be, but when everybody's just so fun loving, and at least from what I've come across.
Great. Thank you, Rebecca. Take it away.
I worked in a cardiovascular ICU recovering open heart patients. I started that right out of school because I was a nurse's aide in the unit, so I started there. And then I worked there for 5 years, and then I applied to the program, got in, and I thought to myself, you've only ever recovered open heart patients. You should really travel and get different experiences in different kinds of ICUs. So I traveled for a year while I waited to start the program. I traveled MICU and SICU, kind of all of upstate New York. I did some assignments in Syracuse, Albany, and one in Buffalo before I started school. Let's see why I wanted to do this. Recovering the open heart patients, I was always curious about what was going on the other side of the double doors. So because they would bring them up to our unit, obviously, and getting a report from them. I have a couple of friends who had kind of progressed from the open heart unit to anesthesia school. So after shadowing, I think that was my biggest aha moment, I want to do this, because I actually was between anesthesia school and perfusion school for a little while. As we started our ECMO program at my hospital, we got to meet a lot of the perfusionists. So I thought maybe that, but then I kind of decided that I wanted to still be a nurse. So anesthesia was my choice.
Great. Awesome. So Nicole, you just finished up your first year. So you haven't done clinical yet, right?
No, I have. I actually, I maybe 5 weeks in, something like that.
But you just started it, right?
Just started, brand new.
So looking back on your first year during your coursework, describe a typical day. How would you prepare yourself for the specific coursework? Because, as opposed to some of the other CRNA programs out there, this is a doctoral program. So our structure is different than some of the other programs. The coursework is different. So just kind of walk us through what an average coursework day would be like for you.
So it was a little different for my class specifically because we were the COVID class and we were all on Zoom, but we started going in person in the spring, and that was a relief. It was really nice to, be in school with everybody, but it was usually 2 days a week. You go into class, and preparing, it's really important to read the textbook before, of course. You know, I would try my best. It's hard, easier said than done, but I would try my best to read prior to class. And then once I get the lecture, then I can kind of go back over what I read, what I learned, and it kind of makes more sense once you do that. And a lot of times the lectures can be recorded if you ask, so you can go back and listen to your lecture, which I found was very helpful for studying purposes. But you obviously can't rely just on that. You have to really pay attention in class, and then it'll click for you later on. But yeah, it was during COVID, even on Zoom, you know, I thought that everything, you know, it went well as far as like, it was the best we could do, you know? So I felt like everybody was really supportive with everything. And yeah, it was a better experience than I thought it was going to be.
Good. Well, I'm glad. And, you know, obviously your experience is a little bit different because of COVID, but I mean, if you were to guesstimate, how many hours a day on average would you be in class, and how many hours a day would you be studying outside of class? Just to kind of give people an idea of like what planning purposes throughout the week they kind of have to look into.
Yeah, so class would be, I think the 2 days a week would usually be like 2 to 3 hours, depending on how many credits and everything. And then outside of class, I'd usually spend, I'd say at least an hour and a half, usually more than that, like, you know, before tests and stuff, but at least an hour and a half every day, like reading and going over notes. I think it's really important to kind of keep up with the work. You don't want to like get behind, because then you're just going to be swamped and you're going to set yourself up for failure.
Absolutely. Perfect. So on the opposite, well, not so much the opposite side of that, but the other side, Rebecca, describe what a typical clinical day is like. I know that is like usually the first question that students have. You've gone through a year of different clinical sites. Kind of walk us through it. What's it like? Maybe some of the sites that you've gone to. I know that Dr. Moscato listed out all of those sites. Not every student, just to be clear, not every student will go to every single one of those sites. That we have a lot, because we have a lot of students. So kind of walk us through what sites you've been at, what a typical day is like.
So I started clinicals last year in June. We were pushed back like a week because of COVID. So my class really wasn't affected as far as clinicals were concerned. So I've been to 2, 3, 4, 5, 6 or 7 different sites, I think. I haven't repeated a site yet. So however that works out. I started my clinicals at Suburban, which, like Dr. Moscato said, very rural, kind of like laid back. It was a good place to start because it's they're pretty healthy patients, pretty like ambulatory surgery, walkie-talkies, and the group there was really good. So to start there was really awesome. I'm currently actually just started today at Niagara Falls, definitely a rural center. It's good to switch it up because of the change of pace. Going from like Buffalo General and that kind of site downtown, like Dr. Moscato was talking about, very busy, very fast paced, a lot of really sick patients, to come to a community center is just a different pace. But a typical day, like this morning, I got up at like 5, sometimes that's 5:30, depending on how much I snooze. I get to clinical usually by 6, really no later than 6. You don't want to be walking in with your CRNAs. That's always a bad day. You want to always be there before then. So typical OR days start at like 7:30. Sometimes there's late start days that start at 8. And they'll, you know, that's site specific. So change, get into the OR by like 6:10, 6:15. Machine checks, drawing up drugs, and looking up the patients for the day. If I don't have site access at home, some places give you like computer access where you can look people up before or the day before. And then I come home, spend usually like 9-ish hours at clinical. So I usually leave by like 3 or 4. And like Dr. Moscato said, the daily evaluations are important every day. I kind of collect those. I come home and I'm pretty strict with myself because I forget to enter my stuff into Typhon. It's a kind of like a tracking system for how many cases you've done and what all the different tasks, like we have to do all the different requirements. So I come home and I enter my stuff into my Typhon. Like Nicole said, I probably spend like an hour to an hour and a half on the clinical nights. just preparing for the next day. If I know what kinds of cases I'm doing, it's exhausting. The clinical days are exhausting. I will not, be positive and upbeat, but that's the truth. But then get up and do it all again the next day. And that's usually like a Tuesday through Friday, sometimes a Monday, depending on what if there's good cases or, whatever.
Great. Well, thank you. Yeah, I mean, it is exhausting. I mean, I don't think anyone will deny that a DNP program, a CRNA program, is not challenging. It's a doctoral program. It's a tough program. So you have to know what you're getting into. So despite, the knowledge that you have going in, that a doctoral program and a graduate nursing program in general is going to be tough, what would you both say was the most unexpected challenge that you both faced? To kind of taking COVID aside, I know that was a challenge for everyone, no matter what, but what was the thing that kind of shocked you the most, and the thing that maybe made you reevaluate how you were planning to study, how you were planning to go through this program? What was the most unexpected thing that you had coming in? Either one of you can take that first.
My most unexpected thing, I think, in the first semester in Principles 1 is it's very like science, very physics based, very like the principles, like the nitty gritty of anesthesia. And I'd been out of school for a few years. So I was kind of out of the school routine, out of the studying routine. And I think the biggest challenge for me was I had to get used to, I would go to class, having read the material beforehand, having a general idea of what we were going to talk about that day, being in class and realizing that I was like a little in over my head until I got home and could study the material. So really, like, the professors are there to guide you and to present you with the material, but a lot of the learning comes from the studying after the fact. So a lot of that, because we are adult learners, a lot of that comes from work we put in after the lecture happens. So it's not just like go to lecture and now I know everything about it and I can take a test. No, it's like you really do have to put in the work after. So I'd always say, like, well, I don't know what they're talking about up there, but I'll go home and teach myself, like, because you just have to put in that extra time. I think it's a lot of hard concepts, and there's definitely not enough time in their day to teach it all to us. So a lot of it does kind of fall as our responsibility.
Great. Nicole?
So like we just talked about, I just started clinical, and my biggest thing right now, I'm still trying to juggle it, is figuring out having to go to clinical for 3 or 4 days and then having to come home and kind of switch gears and do work for other classes. And sometimes it's not anesthesia related. Sometimes it's just general nursing things. Sometimes it's just writing, and kind of having to like totally switch gears. And we get up really, really early in the morning, like Rebecca said. And, by the time I get home, I need a nap sometimes, and it's difficult to get back into a school mode. Usually, when I would work in the ICU, I would come home and I just like kind of relax, but I don't really have that luxury anymore. I have to come home and do work. Otherwise, I'll never have any time over the weekends, to have any fun or, so I have to make sure I prioritize my time, and I'm still trying to figure that out. And it does take time, but I think time management is super important in this program.
Great.
Just reminded me of something. The other part that was hard for me was you all are probably, like Dr. Moscato said again, a great ICU nurse. You're the one in your unit that people come to you and you know how to handle situations. You feel pretty good about your ICU care, and you're coming into a completely different animal. I think it was very humbling for me. It still is every day that you did basic things in the ICU, but you didn't know the why behind it. And like, this gives you the reasoning behind all the things we did. And I didn't realize how much I didn't know. And that was very humbling and continues to be humbling, I guess. So it's going from being like kind of not the top dog, but you're down here again.
Low man on the totem pole again. Definitely.
All right.
You have to be humble and realize that.
Yes.
Good. Be humble. I like that. So obviously there are a fair amount of CRNA schools out there. Some are MSN schools, us are obviously a DNP school. I want to be clear if anyone's not clear, Buffalo only has DNP programs now. So why did you just choose UB? What made you make the jump to either apply or and what made you decide to join after your acceptance came? Nicole, we can start with you.
Sure. So when I came on my interview, I really didn't know much about Buffalo. I had never been here before. I was kind of applying to all kinds of programs. I knew that I wanted to go to CRNA school and I was willing to do whatever it took, you know? So when I came to UB for my interview, I just felt really at home and I felt so comfortable. And obviously the interview process is scary and, you know, overwhelming at times, but I didn't feel like it was so like uptight. Yeah, I felt really comfortable. Even when felt like I wasn't doing well with certain questions or something, I just felt like everybody was very supportive. Like I remember Dr. K, one of the old teachers that worked here, he was just like, "You're doing great. Like, don't worry, just think it through. I know you're trying." Like, and that like spoke volumes to me, you know, because it could have been easy for them to just say, "Oh, she doesn't know what she's talking about." So I was just felt so comfortable.
Rebecca?
Yeah, I would have to agree on the comfort level. I think that the communication for my class, Tanner, it was Louisa, right?
Yes.
Contact person. I think she's on the call. Just that the interface between UB to prospective students was really great. And I know Tanner is amazing. It was super helpful because I had, obviously the application process is long and is, like Nicole said, kind of scary. So they were great in kind of bridging that gap and helping me, you know, get what I needed to get and get everything to the school and all that. Other schools that I applied to, I didn't have that same like camaraderie and experience with. They just were like, "Oh, we get a ton of applicants and, you know, we'll be fine with or without you." But not at UB. I didn't feel that here. And the other thing, I guess, was during the interview, Dr. Corrigoda, one of the old professors, they did so much teaching in the interview between him and Dr. Spulecki. I didn't interview with Dr. Moscato or Dr. Ledwin, but they did so much teaching during the interview, even like Nicole said, out when they were asking us questions, they provided us with feedback and things. So I learned a lot. So I was like, okay, if they're willing to teach me in an interview while I'm not even a student here, I can only imagine like what the program will be. So.
Great, that's good to hear. We aim for that personal attention at UB. Despite UB being a massive school, the School of Nursing, just so everyone knows, is very small. So we try our very best to give you as much personal attention as possible. So I'm glad that it's shining through among multiple classes. We had a question from the chat. On average, how many hours would you both say that you get to sleep a night?
That's funny. I try my best on clinical nights to be asleep by like 11. You know, I feel like for me personally, if I don't get enough sleep, I'll be foggy the next day and I'm not going to function to my best level. So my thought is like the other work can wait. I need to like get myself to bed so that I can be top notch for clinical, you know? So I don't know, how many hours is that? 6, 7 a night? Yeah. So, and I used to work night shift, so that's pretty good sleep for me.
Rebecca?
I am an old lady. I can't, I'll function at 11 o'clock. I think I was in bed last night at like 8. So I average probably a little bit more than other people, but I think it's important just to kind of know what you need.
Yeah.
You know how you function and how much sleep you need based on, you know, your work. But I think I average like at least 8.
And then I guess the last question before I go into the admission side of things, I think most, if not all of the people on the call are getting ready to apply for the next application cycle. Having gone through it, without giving details for what happens in the interview, what kind of is your best advice for the application process for these guys and girls?
I would say definitely review CCRN material, a lot of like the critical care and critical thinking side of nursing, because you're not really expected to know the anesthesia stuff yet. That's why you're going to school. So just being like your best self with critical care nursing, I think is really important. And then also just be yourself. You know, you want to make sure you're a good fit for the school and the school's a good fit for you. Like Dr. Ledwin and Dr. Moscato said, you're going to rely a lot on your peers. You know, you want to make sure that you're going to click well with them and your professors. You know, you don't want to just go anywhere and, you know, dig yourself into a hole that you can't get out of.
Okay. Rebecca?
I would definitely review, if any of you have CCRN, I think the biggest help for me was the Barron CCRN book. I used it to study for CCRN, and it also was super helpful to study for my interview, because they focus on a lot of like patho-cardiac physiology questions. Electrolytes is a big thing that I talked about in my interview. And then just knowing your drugs that you usually give in the ICU, which as an ICU nurse, we may or may not have thought about, like at the cellular level how they're working. But having an idea of that, I think, is helpful. Having a couple of drugs in your toolbox that you know inside and out is super helpful. And then, like Nicole said, I think being yourself, and then again, back to being humble. They know that you don't know all the questions that they're asking, but they know the answers to the questions they're asking. So if you don't know something, obviously don't try it, you know, you can take your best guess at it, but tell them that you're, you know, this is what I'm thinking. And I always like talked out loud during my interview, you know, this is my thought process, that's what I'm thinking, but I don't want to be like guessing or, because a lot of it you can talk out loud and talk yourself through, but don't tell them something that you think, because they know the answers to the questions that they're asking. And just be yourself, I think, is the biggest thing.
Great. Awesome. Well, thank you both. That was a fantastic perspective. I really appreciate it. So now I am going to go into the admission side of things, kind of going over details, because I know that is what a lot of you have questions about. So give me 1 second while I share my screen. Okay. I believe everyone should be able to see this. And before I start, just a few things. Yes, please continue to use the chat for questions. If you would like to send a private question, you don't necessarily want your name read out, that's completely fine. You can send it to either myself or my colleague Louise Case. Louise Case is doing me a huge favor and monitoring the chat so that I can present to you guys. So send it to either of us and we will answer it, no problem there. And then one thing I always forget to kind of mention in my presentation is about campus. UB is part of the SUNY system. We are a massive school. I think we have about 30,000-ish students. However, the School of Nursing is very small. At any one time, we only have about 200 graduate students across all of our programs enrolled at any one time. So you will get a lot of individualized attention. If you are familiar with the University at Buffalo, we are located on South Campus, which is basically in the northernmost part of the city proper. North Campus is out in the suburbs, and then the downtown campus is where our med school is, right in that medical corridor that Dr. Moscato mentioned. Just a little brief thing in there. All right, so let's talk about the application requirements. So what do we require if you are ready to apply to our program? First and most basic, you have to have your BSN in nursing. It has to be from an accredited school. You have to have graduated from your BSN institution in order to apply. You cannot currently be pursuing your BSN. Now, I know some students, particularly students that are in an RN to BSN program, they may graduate in August. That's completely fine as long as you have all the other requirements, but just wait until your degree has been confirmed to submit your application. You must have your active US RN license. That is a big must. And along with that, I know that this came through in some of the questions in advance, because we require an active US RN license, and we require the ICU experience. International students, that includes Canada, are not eligible for this program if they are still living in Canada. You must be licensed in the United States and you must have at least your permanent residency in the States in order to be eligible for this program. Our program is taught in a hybrid format. Because of that, students that have a citizenship other than the States or they don't have permanent residency aren't able to get a student visa. So you must be a permanent resident in the States in order to be eligible for this program. You must have a minimum 3.0 overall and nursing GPA. I'm going to go into the nursing GPA in a second. You must submit a GRE or an MAT score. Again, I'll go over that in a little bit. And you must have 1 year of independent ICU experience. And it has to be completed at the time of application submission. And it does not include any orientation period. I think most of the people on here are nurses or about to graduate their BSN program. Most ICUs have a lengthy orientation period. That ICU experience starts after your orientation. So keep those in mind when you're planning on whether you when you're eligible for the program. I'm sure that we'll get some questions asked about what type of ICU experience we require or look for. I'm gonna defer that to probably Dr. Spulecki when I'm done with my presentation, but we'll go over that in just a little bit. All right, so GPA, this is the thing that I get probably the most questions about because it can be a little complicated. When we review students for all of our DNP programs, not just the CRNA program, we require a 3.0 nursing and overall GPA. I calculate 2 different GPAs. An overall GPA is just the average of all of your GPAs from your colleges, universities that you've attended. So for example, if you went to one school for all of your undergraduate education, your overall GPA is the GPA that you graduated with. Short, sweet, and to the point. A lot of nurses have a few different schools that they went to. Either they took transfer classes or they got a different degree prior to their BSN, all great, but your overall GPA is going to be a combination of all of those that you've attended. Your nursing GPA, on the other hand, is all of your nursing coursework plus some liberal arts courses that most nurses have. However, if you don't have and all of the courses that are on my list that I use, we're not going to make you go back and retake any of that undergraduate coursework. I just don't calculate that into your GPA, so it doesn't help you and it doesn't hurt you. I don't give you a 0 for it, I just don't factor it in. So we don't have any prereqs that we would look for. I think everyone, faculty and staff on this call would agree that if a student doesn't have a sociology 101 course, but they've been in an ICU for 5 years, we're not going to make you go back and retake a Soc 101 course. That does no one any good. And then the other side of that is things like pharmacology and anatomy and physiology. Each nursing curriculum at every school in the country is slightly different. Pharmacology is the best example of this. Every BSN prepared nurse takes a pharmacology course. However, a lot of nursing schools will build pharmacology into what they call nursing 1 and nursing 2. So we know you have it. We're just not going to make you go back and retake it. That's how it all balances out and it works kind of to your advantage there. So the GRE MAT requirements. All CRNA applicants are required to submit a GRE or an MAT score. There are no waivers, no exceptions to this, regardless of academic background. Our program is highly competitive. We are a top 10 program. I believe Dr. Spulecki mentioned that in the chat. This is a competitive program. We need to see your scores. The past year and change, I would say, I think I've only gotten GRE scores because the MAT was not really being offered because of COVID, but either is completely fine. We don't weigh one above the other. And we also do not have minimums that we look for on the score that we require on the test. Typically, our students are in the 50th percentile for the GRE, and typically our students are around a 390 for overall MAT. That's just an average. when it comes to how much they weigh on your application, it depends on you as an applicant. We try to look at everything as holistically as we can, but there is no way around. You must have a GRE MAT score. And please make sure that you're sending your scores to the right school. There's a few different SUNY Buffaloes. We're the university one. So as far as taking the test, because I know that some of you are getting ready to do it, I really don't know what's going on with the MAT, to be perfectly honest. I've gotten really mixed messages about what testing centers are open, what testing centers are not open. The GRE is still being offered at home, and actually even after the pandemic is completely done, the GRE will be offered at an at-home version forever. They've told us, and we're perfectly happy to accept the at-home version. So for you guys preparing. So what transcripts do we require? So to calculate an accurate GPA, I need copies from every school that you've attended. When it comes to unofficial versus official, I have to have official transcripts from where you obtained your BSN, and if you have any type of master's, those have to be official. I can work with unofficial transcripts from every other school. However, if they're unofficial, they still need to be legible and make sense when I read them. For example, they need to have your name on it. If you graduated from a school and it's an unofficial transcript, it still has to say that you graduated. Basically, I tell students, when you're looking to upload your transcripts, look at them first, see if they make sense. I one time had a student that uploaded a transcript with no grades on it. That does me no good. So look at that. I've had a student upload a transcript that was 33 pages long, and they took 2 semesters worth of courses there. That's no good. So just look at them, make sure that they make sense. You know what you took there. You know if you graduated. They don't have to be perfect if they're unofficial, but they shouldn't have been sitting in the bottom of your briefcase for 5 years. So somewhere in the middle there. And under no circumstances, please do not upload any screenshots of transcript. They don't upload well. They get real confusing really fast, even for me who reads about 20 transcripts a day. So just be aware of that. Other application materials, there is a $75 application fee that everyone has to pay. That is actually controlled by SUNY. So the UB doesn't control that, the SUNY does. We require copies of all transcripts, like I mentioned. There will be a personal statement that is changing very slightly. So if you have gone on our website and looked at the personal statement in preparation, please be aware it will be changing very, very, very slightly. That will be uploaded to the website early July. And then we require a current resume and CV. And then we require 3 references, professional references, and they should be written from a master's or a doctoral prepared professional for the program. So if selected to move on to the next phase, you will be interviewing with our faculty to determine whether an acceptance will be granted or not. So application deadlines, and I'm also going to talk about the timeline a little bit. The application for the 2022 cohort will open on August 1st, and it will close on October 15th. As Dr. Spulecki and Dr. Ledwin mentioned, this is a full-time only program, and it starts every summer. So we enroll a few semesters beforehand. That October 15th deadline is when everything needs to be into us. So if that means you are missing everything but 1 letter of recommendation, we cannot consider you for this cohort. So please be aware of that, and please be aware to make sure that your letters of the people writing your references know that that is when they need everything into us by. And then once that happens, we will start interviewing in the late September through October into the beginning of November. The application dates, or I'm sorry, the interview dates are on our website. You must attend one of those 5 dates. However, the interview will be done virtually. You won't need to come to campus. And then everyone will find out whether that's granted an interview, whether they are accepted, waitlisted, or denied from the program on the exact same day at roughly the same time. And it is usually just before Thanksgiving that you will find out. And then you kind of go through the program that way. So with that, I'm going to stop sharing. I'm also going to remove the spotlight from me. Now we are going to open it up to questions. I know that there were a few questions that came in prior through the registration phase, so I'm going to go through those right now. But again, please feel free to continue to use the chat, send questions to myself or Louisa, and we will get to them. I talked about international students. For tuition, tuition is for the DMP program is $1,047 per credit. So basically you take that and you use it however many classes you're taking each semester. That's what's going to translate to that. That is the in-state rate. The out-of-state rate is $1,340. Now, because this program does require you to be in Buffalo, if you are from out of state at the beginning of the program, you will have to move to Buffalo. Starting your second year, you then will be charged the in-state rate, because at that point you will be a New York State resident. So no one, unless you're planning on commuting from northern Pennsylvania, will be charged the out-of-state tuition rate all 3 years in the program. This program does allow you to apply for financial aid. Now, everyone is different in what financial aid they are available. We do have some scholarships available. However, what I tell graduate students for any program, the undergraduate level, when you are applying for scholarships, it's basically you come in as a freshman, those are the scholarships that you're eligible for, that's what you apply for, that's what you get, that's what you have all 4 years. The graduate program, it's a little bit different. You have those that you can apply for at the beginning, then you also have ones that will come up throughout your time in the program. So it's more of a continuous application process there. So that's how we go from there. Non-matriculated coursework, I get this question a lot. Can you take non-matriculated coursework either before you start the program or in preparation for the program? Yes and no. Non-matriculated coursework is based off of availability, based on how many students we're enrolling for the current semester. We obviously have to make sure that all of our matriculated students or degree-seeking students have a space in their coursework. Once we've established that, then potentially you can take non-degree courses. However, it is space dependent. And students can only take at UB, I believe it's 11 credits before they have to be matriculated into a program. So it's not as though you can just take years and years of non-matriculated coursework. You do have to enroll at some point. And then we always get questions about how many students we accept, what our acceptance rate is. That we accept, our cohort size is 20 students. That's how many students we accept. That's how big every cohort is. As far as the acceptance rate, that will change each year a little bit. It depends on the pool of applicants. So basically, I can run down last year what our application pool was like, and it was a pretty good barometer of what is pretty typical. We had 85 people last year submit an application. Of those 85 students, 42 were granted an interview. Now, the remaining 40-some, it's not as though they were all denied an interview. They either didn't complete the application process, they didn't do something, they withdrew on their own, and some were not granted an interview. Of those 42, we accepted 20, we waitlisted 21, and then we did deny 10 students. It happens, it's a competitive program. So that's pretty typical of what we do each year going forward. So I don't know, Dr. Spulecki, do you want to talk about kind of what ICU experience you all like to see, what you think makes a well-rounded applicant when it comes to ICU experience?
Sure. I think that if you have an ICU experience in a level 1, 2, or 3 center is an excellent place to be. especially if you have the autonomy that maybe some ICUs have over others in regards to standing orders or making patient decisions based on standing orders is a good place for you to apply into this program. Usually medical surgical ICU or cardiac ICUs make for very strong candidates. That doesn't mean that working in a medical ICU or in a pediatric ICU or a NICU isn't necessarily a strong candidate, but because it is pretty much centered as an adult program, although we do have pediatric anesthesia experience, you will find that most of the material is around the care of an adult patient, and any kind of experience you've had with more complex pathophysiology will be very helpful to you and to the program.
Great. So that was the formal things that I prepared. So I'm going to stop the recording for right now, but we're still going to stay on for questions.